following segment is sponsored by Intermountain Healthcare. A new study found that vaping can cause major health side effects. Dr. Denitsa Blogev is the principal investigator of the study and a pulmonary and critical care physician at Intermountain Healthcare. She is here to walk us through the findings. Doctor, thank you so much for coming in.
My pleasure.
So let's talk, what are the impacts of vaping and smoking?
So vaping and smoking have a lot of health impacts, and really we've learned over the years a lot about the impacts of smoking, risks of COPD, lung cancer, lung disease, and vaping is really the new thing that's come on, that initially people were thinking, oh, this is going to be safer than smoking, and this is the thing that we're learning more about. So one of the things we all learned about over the last couple of years was vaping-associated lung injury. So when people get really severe lung disease due to vaping. And
then you just said that EVALI is a term that you taught me before this started. So for the public out there who doesn't know what EVALI is, can we talk a little bit more about that?
Absolutely. So EVALI, which stands for e-cigarette or vaping-associated lung injury, is a pretty immediate effect of vaping. So people that vape within 90 days develop really severe lung injury. So things like low oxygen, shortness of breath, their lungs fill up with fluid and inflammation, and in severe cases they end up in the intensive care unit needing breathing machines to try and get better.
So very serious. And so tell us about the factors of the study. Who was monitored and for how long?
So one of the things that that we knew we had to do when EVALI was discovered in 2019, and we recognized...
that's been really recent.
Yeah. Okay. Isn't that amazing?
Yeah.
So that was the outbreak in 2019 when all of a sudden we were seeing young people in the intensive care unit and dying from vaping-associated lung injury. And nobody really knew what happens to those people after that diagnosis. Do they recover completely? Do they go on to have normal lung function after that illness? Or are there long-term consequences? And that's what we were trying to study. So our study looked at people that were diagnosed with EVALI, and we wanted to know what the effects were long-term.
Okay. And so what were the other side effects patients were struggling with, like paying for bills and things like that?
Yeah, that's right. So, so we found a number of things. So one is that 39% of people with EVALI had evidence of cognitive impairment, meaning they couldn't think clearly or make decisions.
Okay.
So not just a lung problem, but kind of a brain cognition problem. And it seems counterintuitive, but I think with COVID, actually, people are recognizing that you can have a lung illness and then have a total body impact. We also found that a significant proportion of people had respiratory symptoms. So 16% had quite severe respiratory limitations, but up to 40% had milder respiratory limitations. And then these are young patients, right? So people who smoke are really young people, and we were interested in how that impacted, how this illness impacted their lives in terms of it's really expensive to be hospitalized as a young person.
So this study has opened up so many doors for you to realize how what vaping is doing, how to help people. Where can we go for more information?
So we can go to the intermountainhealthcare.org website for more information, and really 1-800-QUIT-NOW is the Utah Tobacco Cessation line, and they help with vaping cessation as well.
Doctor, thank you for everything you're doing and taking the time to come in and talk with us.
My pleasure. Thanks.